the newest member as a dentist to Supreme Dental. Welcome, Dr. Mitch.
Thank you, Frank. Nice to meet you guys. Sometimes I speak with my patients, but the most important is speak with the person, with the people.
And after I came out of the interview with you, I went back home and I told my wife, I said, I think that we found who we're gonna make join to Supreme Dental. And
so my exercise is I say the patient, if you can touch the palate with the tongue,
your upper palate with your tongue,
and move your tongue with the back part. Okay, and that is your normal bite.
How many videos have you recorded from us?
I don't know, 300?
And have you ever heard about this?
I don't remember.
I've never heard about this.
Never?
No, I mean, I've heard about it takes time to your muscle memory to come back, but not exercises to make your... That's very interesting.
Makes sense?
Yes.
It does make sense. So where are you going? Where are you going in October or November?
November, Switzerland.
You're going to Switzerland, huh?
Yes, it's amazing.
Welcome back to Supreme Dental Podcast Studio. You can be anywhere else in the world right now, but you're here with us, and we appreciate that. Don't forget to like and subscribe. Remember, this podcast was meant for you, our patients. My wife and I are the owners of Supreme Dental Clinic. Remember, we're now on Spotify and an Apple Podcast. Today we have the newest member as a dentist to Supreme Dental. Welcome, Dr. Mitch.
Thank you, Frank. Nice to meet you guys. My name is Dr. Mitch. It's a pleasure. I'm here.
There you go. Dr. Mitch, I want our audience to know a little bit more about you. Okay? I'm going to be asking you a couple questions. I know that Spanish is your number one language, and yes. I know you've never been on a podcast before.
No, it's my first time.
This is your first time,
yes.
So you're nervous?
A little bit.
You were rapping before we got into the podcast, so that was pretty cool.
Yes, I can rap the game.
There you go. So tell me, who is Dr. Mitch? Tell me about you. Where are you from? Everything.
Okay. I'm from Culiacan, Sinaloa. I born in Monterrey, but I live in Culiacan for 22 years. I studied in University of my state, is Sinaloa. I am a single person. I'm like the sports, the animals. I like pass time with my family, and I have a passion. Is the surgery, is the implants, but the most important for me is the connection with the people.
The connection with the patients.
Yes, with the patient, with the people. Sometimes I speak with my patients, but the most important is speak with the person, with the people, not with the patients.
Okay, so you want to get to meet them as a person. You want to connect more with the person itself.
Yes, because sometimes I speak with my patient, but the patient no is expressive. The person is more expensive.
Yeah, sometimes the patient is more reserved because
yes.
and you want to get to know more like a person.
Yes, so the connection for me is very important.
Okay. You said your passion is surgery and your passions are implants.
Yes.
So far, you're an implantologist. Tell me, this is not the first clinic where you work at. Mm-hmm. You worked in other clinics before.
Yes.
You worked in, how many other clinics have you worked in before you worked in Supreme Dental? 1, 2, 3, how many?
Here in Algodones?
In Algodones, yeah.
3 clinics.
And overall?
5 clinics, yes.
When you said there was 3 other clinics that you worked before you worked at Supreme Dental. you put an application at Supreme Dental, and it took time for us to give you a call.
Yes.
Then we gave you a call.
I think the Supreme Dental is the best clinic in that place, in Algodones. For the compromise of the doctors, for your compromise, like owner, and the whole team. The assistant is a good person, is an excellent team. The other clinics, same, is good clinics, but here the excellence is the number one objective, and I like that.
When you got a call to come interview, because you interviewed once with Dr. Elias, was it? Who was it? Who interviewed
Yes.
you the first time?
Dr. Elias, Dr. Luis, and Dr. Alonso.
Okay. And then after that, we called you back for another interview, and I think the interview was with me.
Yes.
Okay. What did you feel when we called you for the interview? And when you came to your interview, there was 3 guys interviewing you, 3 doctors that I'm sure you've seen on Instagram, that you've seen them here, that you've seen the cases that they do,
Yes.
that they've been to trainings worldwide. How was that interviewing with them? Like, how did you feel? Were you intimidated? Were you proud? Like, were you scared? Tell me how did you feel?
I was a little nervous. I think it's normal, but the most important, I feel it motivated.
Motivated.
Yes, because Dr. Elias, Dr. Luis, and Dr. Ernesto is excellent doctors, and I have your Instagram in my page, and I can see your cases, your patients, and I think it's amazing. Really, it's amazing his work. I wanna work with that doctors.
How did it feel when we gave you a call? Did you believe that we were gonna give you a call? When we call you for the first time, hey, come interview, or I think I sent you a WhatsApp. What did you feel?
I'm excited.
Excited?
Really excited. Remember, when I see the WhatsApp, your WhatsApp, I think I was with my girlfriend, and I think, oh my God, it's fine, and that's my opportunity. So after that, I feel motivated. Okay, I feel a little nervous for the new experience, because I think it's normal here in Supreme Dental. The excellence is normal. Okay, the quality of the jobs is normal here, and that no is normal in other places. So yes, I feel a little nervous, but more excited.
Welcome to Dental Facts. Toothpicks are the object most often choked on by Americans. You heard it first at Supreme Dental Podcast. Floss, brush, and keep smiling.
I'm gonna tell you that when I interviewed you, when all 3 of the doctors interviewed you, we interviewed I think 4 other doctors, and I spoke to each and every one. I spoke to Dr. Ernesto Alonso. I call him Dr. Alonso, Dr. Luis, and Dr. Elias. I told them, what do you think about this? What do you think about that? And they all gave me a name of who they thought could come into the clinic. And off of those names, I interviewed 3 doctors. And you were one of them. A lot of the times here in Algodones, there is different rumors from different people. And sometimes if you let what other people say about different people, it may be wrong. So I like to give everybody the benefit of talking to them and understanding and seeing where they're coming from. My 3 doctors interviewed you because of your experience, but my interview was more for connection and for the human side, because if you're not going to connect with my team, if you're not going to bring that positivity, then I don't want you in my team. And after I came out of the interview with you, I went back home and I told my wife, I said, I think that that we found who we're going to make join to Supreme Dental. And there's a lot of people that lie. A lot of people that say, oh, yeah, I can do this, I can do that. But then when I got them in the front, I didn't ask them, so you can do this? And they're like, no, well, I've done it once. You know, that I don't like that. I want you to tell me where you're at. I want you to tell me the truth, you know? So, and we decided to add you because of your humility. You're humbled. You were like, you know what? I want to be here. I want to get better. And this is where I'm going to get even better. And I want this opportunity. You reminded me a lot of Luis when he started.
Really?
Yeah.
Wow.
But Luis is not as good looking as you, as George knows. But he's he reminded me a lot of you. You reminded me a lot of him. And I said, let's do it. And obviously you were put onto the test. Everybody's looking at your work. I told you, you're going to be on probation. We're going to be seeing everything you do, and you can take on big cases. In those first weeks, you were in surgeries up to like 12 o'clock at night. You would stay with Dr. Luis. You would stay with Dr. Elias to take a look at their work, because you wanted to see how things were done different. You wanted to see how they did things, and that described me who you really were, that you really wanted to move on forward.
Oh.
We had the Infinity Stones. We had people that visited us like 2 weeks ago, and they were really surprised with how you were, the way you handled yourself, the things of how you were, how you explained things to them, how you took the time. Dr. Luis has said nothing wrong. I mean, Dr. Elias, Dr. Alonzo, even Dr. Spooky, they've been like, oh, you know, there's going to be things that, you know, you're going to be learning. You know how to do things, but we do things, like you said, with excellence. We want things to be done a certain way because we know they work, and you're really good at, you know what, understanding and saying, you know what, that's why it works out better. So on that, congratulations and welcome to the team.
Thank you, Frank.
No problem. Now tell me, obviously when the four agents came down, you told them about an exercise about after you get your crowns done, or what is that?
For crowns?
Yeah, before or after you get your full mouth, you told them that you have to do an exercise.
Yes.
They asked me, can you please ask him if he's going to be on the podcast, that if he can tell us about that exercise.
Okay.
What is that exercise, and when do you require it?
Okay, the exercise is with the tongue.
With your tongue?
Yes, but is with the tongue for the mind, because the mind need time, the brain need time for recover the information, the new information. So my exercise is I say the patient, if you can touch the palate with the tongue,
Your upper palate with your tongue?
and move your tongue with the back part.
Okay.
And that is your normal bite.
Okay.
So if you can do it and you can repeat 20 times per day, your brain accept the new muscle, the new movement, the new prosthesis, because the prosthesis is prosthesis. Okay, all is new. Sometimes the patient say, I feel different. Yes, it's obviously, but your brain needs time. So with that information, the patient accept the new change, and with the exercise, with the repetition, with the exercise, the brain of the patient start
Accepting the new bite.
the new bite. Yes, accepting the new bite.
So one more time, you put your tongue to touch your upper palate, and then you push your tongue back.
Yes.
and that is your bite.
Yes.
And do that exercise 20 times a day after you received a new smile or all on fours or whatever it is, because it's no longer your natural teeth. So with that, you will get your brain to adapt to what your bite
Yes.
is now, and it'll be a lot easier for you. Is that what it is?
Yes. Yes. It's with the time. Okay. Sometimes the patients lost the vertical dimension or lost your normal bite, so it's necessary the movement. It's necessary the that exercise for recover the information of the muscle with the brain.
Did you know this, George?
No. I'm not a dentist.
But you're married to a dentist.
Yeah, but
How many videos have you recorded from us?
I don't know, 300?
And have you ever heard about this?
I don't remember.
I've never heard about this.
Never.
No, I mean, I've heard about it takes time to your muscle memory to come back, but not exercises to make your. That's very interesting.
Makes sense?
It does
Yes.
make sense.
For example, 6 months ago, I have a lesion in my leg. I play football, so in rehabilitation, the doctor say me it's necessary exercise for the muscle recover the information
muscle
of the
recovery.
move. Okay, so I think in the mouth is the same process because it's the body. So yes, that exercise is very important. Is the other 50% of the treatment, I think.
Yeah. 50% of everything is the patients when they go back home, and 50% is we do here. So yeah,
Yes.
it makes sense. Doing the muscle memory, that's interesting. That's very interesting.
Yes.
That's very interesting. Obviously, we've seen your work, and we'll put a couple of work here, a before and after. George, we'll do it before, and then we'll do an after of what you have done, and you've done beautiful work.
Thank you.
You've done beautiful work. I have to say that you're very particular. And when I interviewed you, you told me you were going to give it your all, and I think you've been giving your all. Now tell me that I asked you about 2 weeks ago if any other clinic had sent you, or if you had gone anywhere for training anywhere out of Mexico or out of the city that you lived in, and you told me that you have not. So where are you going? Where are you going in October or November?
November, Switzerland.
You're going to Switzerland, huh?
Yes, it's amazing. It's honestly, my dream is now Europe.
Europe.
So Switzerland is a dream. Really, is a dream for me. I feel very happy, and that is really motivated for me. It's 100 motivation.
First, you were going to go to Punta Cana, was it? República Dominican?
Yes.
And then it got postponed to 2025. So I think about a week ago, I called you, and we have, just so you guys know, with Straumann implants, there's a total of 4 different spots in Mexico that could go to Switzerland with Straumann, and not just do training with Straumann, but also get to meet the facilities. It's a huge facility place. And there was only 4 spots in Mexico, and Supreme took all 4 spots. So what this means is that Supreme will be representing Mexico and Switzerland to Straumann. And Dr. Mitch is going to be one of them.
Yes.
And we have Dr. Elias that's also will be there. Dr. Ivan, a.k.a. Dr. Spooky. And your very own George. He's going to be able to record. I don't know how George goes to Singapore and then goes to Switzerland, and he should just be going to Mexicali, but he's going to all these places. So we're very proud, man. We're very proud. We're very happy. We're the kind of team at Supreme that if you put in your all, we put in our all also. So when we see that you are really pushing forward and you're really wanting to learn, and you have nothing but a positive energy, so you've been super positive while you're here.
Yes.
I believe you're a positive guy, and you can't. That's something you can't learn. So you can learn how to do better techniques, palatal approach, nasal floor lift, transnasal floor lifts, but you cannot learn how to be human. You cannot learn how to be humbled, how to be positive, and you have those qualities. So everything else we can work with and we could make better, and we will get better. But obviously I expect big things from you, and so does the rest of the team. And the podcast today, I told you this morning, hey, you're gonna be on the podcast.
Yes, was a surprise for me.
It was a surprise.
Yes.
And you said, all right, like right now, like this Friday, and I said like today.
Yes.
And you said, let's do it. What are we going to talk about? Dental stuff. And you're like, but what? And it's freestyle, you know, we just talk and we just have fun with it. So what's next? What's next for Dr. Mitch? And I say Dr. Mitch because what's your full name?
Michel.
Michel?
Elenes. Michel Elenes Dominguez.
Michel Elenes Dominguez. Say that 4 times quick. You can't do it. So I just call him Dr. Mitch.
Así es.
It's a lot easier. Dr. Mitch.
Dr. Mitch, I like it.
You like it?
Yes.
So what's next for Dr. Mitch?
Well,
Where do you see Dr. Mitch in 6 months?
in my future plans is I wanna improve in all my aspects with person, with professional, with person. I think in that profession is very important improve your communication with the patient. So I wanna learn new treatments for solutions, for new solutions with the patient, for new solution with the team, with all the clinic, and with person, because it's very very important for me the connection with the person, with the people. I think is very important the inspiration. Every morning I wake up and I think today is a good day. Today is a great day. I wanna be my best person. My best present. So probably in 6 months I will better person, with better professional. I don't know. Probably in Switzerland.
Maybe in Switzerland. Well, yeah,
Probably in Switzerland.
You will be in Switzerland.
Christmas.
Yeah, it'll be Christmas. Also, yeah, in 6 months. There's
Yeah.
George. That's why we don't put George in the podcast anymore. So, is there anything, anybody you want to say hi to, or there's the camera? Anything you want to say to our patients? It's all you. What do you want to say to our patients?
Okay, guys. For me, it was a pleasure. Nice to meet you. I'm here for anything. If you want a question for me, if you want everything of you need, for me it's a pleasure. I'm waiting for you.
There you go. And anything you want to say hi to anybody?
Sorry?
You want to say hi to anybody?
My girlfriend, my friends, my family.
There you go.
Thanks for all.
He's a podcaster now. He's a podcaster. So thank you so much for being here. Thank you so much for interviewing. Thank you so much for taking the time. I know that you put in that that resume, that curriculum. You put it in and you waited and I sent you a message and you were on it. And then I remember I gave you that call and I told you, welcome to the team. And you were shocked. And I want people that are happy to join my team. And you were very happy to join my team. And you told me you're going to give it your all. And so far, you've given me a lot, but I expect a lot more.
Thank you, Frank.
And I will be here to, just like everybody in our team, to push you like you said, there's good, but there's also greatness, and you're very good right now, but we are here to make you great. So thank you so much. I want to thank everybody else to be there. He was a request. A lot of our patients, a lot of our agents wanted Dr. Mitch to be on the podcast. So thank you so much for listening, guys. This has been Supreme Dental Podcast Studio, powered by Supreme Dental. And just like Dr. Mitch, keep on being positive and keep on smiling.
Thank you.
Have a good one.